It's a very similar question, but someone didn't maybe understand how does the AI work. They're saying it seems that the diagnosis of misfit of aligners is made by the clinician after looking at the photo.
Yes, yes. So they send us an automatic checking mail, checking alert, and then we check the real photo, and then we call the patient. And AI checking the photos automatically, and in dental monitoring companies, dentists will also checking. So double check and send an alert. And we saw an alert and actually this is a triple check with in our clinic, and then send a real message to our patient. So that is really a triple check.
Perfect. Someone is asking about when you do cases with mini screw, the patient, they need to wear how many days for each aligner? And if you have no-go, how many days they need to wear the same aligner?
So it depends on the movement, but normally we ask patient for 1 week treatment protocol, but some patient using orthopulse. That's 3 days or 4 days protocol. Wearing elastic with liner with whole days, more than 20 hours a day.
And to avoid refinement, does the patient keep an old aligner?
Yes.
Perfect. That answers the same question as well.
We ask the patient to keep all the aligners until they come to my clinic and see directly and fitting perfect. Then they can release all the aligners. In a teleorthodontic test, they need to keep all the aligners.
Perfect. So Dr. Arimoto, we have some people who are interested in to start implementing this new technology, and they're asking, would you share a good tip for new doctors who are going to start with remote monitoring system, please?
Yeah. So remote monitoring system is it's just start just starting is really important, and we start with a coronavirus situation. We start almost all the new patient from 2015. So it is in the first time it was a really complicated situation, but it's easy to start.
And when you started, did you have any difficulty? And if you were to do it all over again, would you do anything differently?
Not really difficult. So taking a photo, just instruct taking a photo and using a software application. And it is now our staff member doing it with maybe 15 minutes to prepare for start using our dental monitoring system.
That's awesome. So yeah, some people are asking that, if you use the system with so many patients, then you will have a lot of photo that you'll be receiving through your dashboard. Is this a problem? Are you able to handle and to cope with all of this information?
Yeah, that's not really a big issue. So staff member can do it with free of time, without patient time, and doctor will not check every photos, but staff member do it. And staff member need to precise looking at the pictures only with AI alert, only with the AI alert pictures. So that's not a really big issue.
That's awesome. And so, because you used to do this before you started the remote monitoring, you used to do Invisalign alone before, and now you do it, the two of them combined together. Did you see any difference when it comes to number of appointments that you need to schedule in office, the efficiency of the treatment, and maybe accountability of the patient?
Yes, Invisalign, and sometimes they send personal photos without the dental monitoring. But now we are planning to make a next appointment only with attachment setting or mini screw placement or just IPR setting. So maybe average duration is 3 months, 3 to 4 months.
Perfect.
We don't see a patient.
And what about the number of refinements? Did this number decrease with time?
Well, my feeling is that little bit reducing, but I have not enough data. I have not analyzed the data. But some patient not feeling well can be recovered by sending a message, and that worked well. So that is a result of reducing number of refinement, I think.
For sure. So when it comes to the information you receive through the dashboard, what the AI notifies you, do you feel that sometimes it alerts you with the wrong information or the wrong diagnosis?
Excuse me?
When the AI sent you a notification, right? It did a diagnosis of a misfit, for example. Do you find that sometimes the AI send you false information? Would you find yourself that you can't trust it?
Sometimes AI send us false information. That's really really precise, and sometimes AI miss the broken attachment. So and they tend to find out the unfit. So even little bit unfit, they will send us and send the patient automatic message. You have a unfit here and stop changing aligners. That will sometimes a really problem because a patient is really disappointed. So we need to motivate the patient again. That's the issue. So we need to customize the automatic comment. We can customize it. So that will be taking the time with starting dental monitoring system. Maybe we took 4 or 5 months to optimize the customization of an automatic message.
So with any AI system in the world, you need to customize before you fully automate the process. Yeah. And someone is asking, is there any limitation when you do your treatments using this system?
Well, I don't think so. So as I talk in my lecture, molar position is sometimes it's really difficult to already detect, and I place sometimes a lingual attachment, but lingual photos are not included in this system. So sometimes it's lingual attachment is broken, and we don't realize that, and some unfit issues are coming. So that is a limitation, I think. And mandibular position. Mandibular position is just a patient just biting their muscles. So that is not always correct mandibular position. So that is why APR evaluation is difficult with this system.
Someone has a question regarding OrthoPulse. Is it working for extraction case or only works for IPR case?
I use both. I use even in an extraction case. But even you use OrthoPulse or not, the keeping perfect fitting is really, really important. It's all about the Invisalign treatment. So even in OrthoPulse treatment, we use extraction case, and we use teleorthodontics also, and that worked well.
Great. And now going back to the remote monitoring, the dental monitoring system, how much time do you spend on the dashboard every day? Are you wasting your time, or is it the team doing it for you?
As a doctor, I don't take a time for reviewing the photos. So my staff member total 1 hour a day costing evaluation of and sending back some private message to the patient.
Perfect. Now another question, how would you assess sagittal improvement during elastic wear, since the photo are taken from the front?
Yeah, dental monitoring has not only a frontal photo, they should take a lateral also, and wearing a liner, without wearing a liner also. So that is we can recognize that they are elastic wear very well or not. But again, AP correction is sometimes very difficult. So make sure that, for example, distalization case. So after distalization stage, I want to call up to visit my office, and we can get proper amount of distalization is getting.
Perfect. We're getting a lot of compliments in the chat box, Dr. Arimoto. They're saying, thank you. This is a great presentation. Very informative, very humble man. Now, baby, I'll ask you a question that is a bit broader. You might not have the definitive answer, but it's a nice brain teaser. How can we encourage healthcare providers, especially remote areas or countries where digitization and using technology is not much familiar to them? How can we motivate them to be more technology friendly?
Well,
that's a hard one.
Well, in my clinic is, for example, first appointment should be from a website, and I don't very rare to call up phone call to make a initial appointment. So not so many patients are not using a digital device. Some older patient only using all type of mobile phone, not a smartphone. That is a problem. But in that situation, we just call a regular appointment system. So, but many of that patients are loving to use that, taking a photo with a scan box. So that's not a big problem.
Dr. Arimoto, you showed a very interesting case where you had 90 aligners to finish the case. And someone is asking, is it normal for cases to go above 90 sets of aligners because they didn't catch the answer?
Yeah, for my ClinCheck, tends to make many number of aligners because I want to separate the sequence. So and big attachment. But I use, in such a patient, I use also pulse, and treatment time is not so big. But over 90, over 80 is not so, it's normal, normal for me.
So someone is asking, do you find that the Invisalign or the aligner treatment in general can be more effective compared to traditional way, like using braces?
Yeah, it's a totally different system. So mechanics is different, and but I like Invisalign treatment because they need patient cooperation, patient compliance. So that is sometimes said that not a good point for aligner system, but I think it's a good point because that is changing the life habit of a patient to a good habit. So to become a good future, we need good current status and good habit. So Invisalign treatment is incorporate both two aspects of good status and good habit. So I like that Invisalign treatment. But some movement like rotation of the teeth and some minor control of the teeth is actually a good with multi-bracket system. So sometimes we offer to correct a severe rotation, especially for lower premolars. So sometimes offer with a multi-bracket system with 3 months. But mostly I use Invisalign treatment now.
Thank you so much, Dr. Imoto. So we have the questions keep coming in, but conscious of the time, we'll take 2 more questions and we will conclude the discussion. So the first one is there anything that I should be aware on ClinCheck when I'm extending the visit interval?
Well, I try to set the IPR timing as same as possible, and I planning to reduce the office visit. So placing TADs or making IPR or placing attachment, removing attachment. So they should as same time as possible. I will plan for ClinCheck.
Awesome. Now the last question that we will take live, and then for the rest of the questions, like they sent you in the chat, you can always send them on the email events at CAPMEA. You have the email in the chat, and if you have any question about dental monitoring, you can also send an email to support@dentalmonitoring.com, and the team will be more than happy to answer you. So the last question for you, Dr. Arimoto, is the following: do you use the dental monitoring system for Invisalign first case? For example, when exfoliation of the baby teeth and partial eruption of permanent teeth affect its accuracy, and always have until alert?
Well, in Invisalign first case, I use rare. In Invisalign first case, we always ask patient to change every 5 days, and they tend to break aligners very frequently, and they tend to live really close to the office. So it's very rare to use a dental monitoring system in Invisalign first case. But in adult case, they live very far, that's very useful. But in first case, it's I don't use much.
Awesome. So thank you so much, Dr. Arimoto, for your presentation today, for taking the time to answer all of the people's questions. Now, I'm sure a lot of people, you know, they are still connected, they are still engaged in that conversation. They still have a lot of questions on their mind, but unfortunately, we don't have all the time in the world. So, you know, they will be contacting you via email. And if you have any question for about dental monitoring, you also have our email in the chat. Thank you so much.
Thank you, Dr. Ryan. Thank you, Dr. Arimoto, for the very thorough presentation. It was very interesting, and always judging by the amount of questions, we can see that the participants really enjoyed the topic. So thank you also to Dental Monitoring for the support and making this webinar available during these challenges times for free. So on behalf of Dr. Molova and CAP, we would like to thank everybody for attending. We will be issuing your certificates by email in the coming few hours. They will be sent alongside a survey, which we would like you to please fill in before downloading the certificate to help us improve your experience in the future. If for some reason you are not able to receive your certificate by tomorrow morning, please do not hesitate to contact us to the email events@capnia.com, which you have seen a number of times already pass on the chat. In the same email, we will also send you this recorded webinar so that you can rewatch it in the coming days and have a refresher. So on behalf of everybody here at CAP, thank you. Take care, stay safe, and we hope to see you soon again. Thank you, Dr. Arimoto, and thank you, Dr. Ryan, and thank you, Dental Monitoring. Have a pleasant evening. Thank you.
Thank you.